It's important to look at what's out there, what's available to you, and how are you thinking about cancer and your strategy for cancer. So we're going to try and spend a little bit of time talking about that today, talking about how we're approaching this today and how you may want to think about approaching it. And hopefully, maybe at the end we'll have time for questions and answers, we'll see. But there's a lot of information to get through because cancer is a complex disease, right? It's multifaceted. There's so many things you have to pay attention to when you think about managing cancer. So we're going to spend some time talking about this today. Let me advance this here. So, that's bright. Okay. So you'll see on the slide here, right? So take control of cancer, right? It's a bold statement. It really is. When you think about managing cancer, and driving an ROI from cancer, you have to take control of it. You have to manage it appropriately. Right? You have to manage the disease itself and manage the members that are going through that journey throughout every phase of it, right? You have to control it. And we've been doing a lot of work with the American Cancer Society to really try and help organizations determine how to take control of cancer, right? And we believe we can help you do so. And so just background on color, some of you may know us or think you know us. I'll walk out of the screen here so you guys can actually see what's happening over there. Sorry about that. So Color is an organization, right, that's been around for a number of years. We have a very unique partnership with the American Cancer Society. We're the first for-profit organization that they've ever worked with in their 100-year history. And we really are the operational and clinical organization that takes all the 100 years of research and tools, right, that the American Cancer Society has and applies it to the marketplace. But we're not just really focused on the American Cancer Society, although they're an important partner, right? We also work with a lot of large employers in the market to try and manage cancer. You can see some of them here. And we're also a very scientifically driven organization and clinically driven organization. So that means we work with the NIH, right, in the largest cancer study in the world. We're working with organizations like Fred Hutch and Mayo and UCFS to do the largest breast cancer study in the world right now. And we've been around for 10 years and really focused on cancer, starting with the BRCA gene 10 years ago and working with a scientist who discovered that gene and making it really accessible to everybody. And so I say this to you because over the last 10 years we've managed hundreds of thousands of lives of patients who have cancer. And so as you're thinking about cancer, it's important to think about who you're working with, right? And so when we think about cancer, there's a couple things to think about. So first is, let's take a step back and think of how most of us in this room think about cancer today, right? Most of us in this room think about cancer when it happens, right? And we manage treatment because that's when cancer becomes real. That's when the costs explode, right? If you think about cancer, it's not episodic. Cancer is not an episode in time. It happens over time, right? It progresses over time. And so you need to think about managing it that way. And if you don't do that, what's happening when you think about driving ROI and savings for your organization, right, is you actually leave a lot on the table. You actually have very limited impact on survivorship for members, and you have very limited impact on your savings opportunities, right? And so the way to think about cancer, or the way we like to think about cancer, is thinking about it holistically, right? You can use the word comprehensive, you can use the word full spectrum, whatever statement you want to use there. But you need to think about it throughout this entire journey because, as I mentioned, it's a disease state that progresses over time. And by doing so, by thinking about how you're going to think about a real solution that's not a point in time, but managing this entire journey, right? Starting with early detection, detecting cancer as early as possible, shifting the stage of cancer from late to early, right? Because there's, obviously the treatment modalities are much easier to use. It increases survivorship. Getting people in treatment appropriately, right? And then don't forget about your survivors, guys, right? There's, just because treatment ends doesn't mean that there's not cancer survivors out there who still need your help. Only by doing this, only by taking this sort of broad approach, do you really open up the opportunities for savings and ROI. You sort of shift this conversation from one of cost, focusing on cost, to one of savings, and you shift the conversation from one of hoping your members survive to giving them a real chance and making them a real impact on surviving. So let's talk about this. So how do we do this? How do we think a little differently about this? So one thing is that we've done is we've really tried to focus just on cancer, okay? So cancer is not a disease state where you just want to slap some stuff together and hope for the best. You need to really focus on. It's a very complex disease state. There are thousands of mutations of cancer out there, and each one is treated slightly differently, right? And so focusing on cancer really helps when you're thinking about how am I going to manage this disease state. The other thing that we think is really important in this space is that because it's so complex, right, is try to own as much of that journey as possible, right? So owning and creating a vertically integrated solution set that includes cancer-specific PCPs, right? Like think of this as your PCP that just focuses on cancer. That's available in all 50 states, right? Nurse oncologists, right? Care coordinators, the people that are actually going to manage every aspect of care for individuals going through this journey, right? Making sure that you can have the labs and testing in-house, making them available wherever possible, making sure there's clinical rigor and quick turnaround times, right? Making sure that you are managing people throughout this entire process, and when they need someone to call, there's somebody there, right? Because you don't know when a flare-up from cancer is going to happen when you're going through treatment. And you don't know when your caregiver that's taking care of you is going to need to talk to somebody, right? Leveraging AI appropriately. I mean, you heard about AI earlier, right? You have to leverage it. There's great opportunities in cancer for AI, but how do you do that? And then let's not forget about the mental health aspect of care, right? So making sure that you're mentally taking care of members, really focusing on, we've worked to create the only cancer peer-led support group organization in the country right now, and you can't ignore that fact. So what does this mean, right? Let's get back to ROI. Let's get back to what we're talking about from a data perspective. So when you think about cancer and starting at the first phase of this, how are you going to detect it early? How are you going to get to diagnosis as quickly as possible? Well, the first thing you have to do is you have to understand risk, okay? Because 10 to 15% of us in this room are probably at high risk of cancer based on general demographics in the US. That means that our guidelines for cancer screening and the needs that we have are not what you're going to get when you go to your PCP, because the recommendations they have are based on standards of care for average risk patients. So you have to understand a risk, and then you have to understand what you need to do to manage that risk, right? So you as an individual, what is your risk and how do you actually manage through that risk to make sure you're getting screened appropriately? How do you pull through the screens? How do you actually close these gaps? You got to make it simple, right? How are you going to make it simple for your members to follow through on getting screened on cancer, right? Bring it to their home, bring it on site. If it's a screening that isn't available to be done at home or on site, manage that entire process for them, right? Schedule those mammograms and those lung CTs. Get them in 2 weeks or less, not months, right? Follow through on the abnormal results so that they're actually following through. The biggest gap right now in cancer screening, guys, is not necessarily people getting them done, although that's a big issue. It's when the abnormal result comes back, the majority of people do not follow through on the next phase to actually understand if they truly have cancer or not. And suddenly there's a high cost claimant that comes out of nowhere, right? You've got to close that gap. And so making sure that happens is really important. And when you do those things, this is what can happen. When you engage people appropriately and help them understand their risks, you can drive high utilization rates, you can close screening gaps, and because we built this vertically, right, you can just save money from day one. All right, so that's the first step to ROI, okay? Managing treatment. We can't ignore people that are in active treatment, right? About 1% or so of people actually get through to the point of treatment in a book of business on average. 50% of the people in this room are going to have cancer at some point in their life, right? Someone's in this room is going to have cancer, unfortunately. When you get to this point in the journey, right, you are scared, your caregiver teams are scared, right? There's a lot of moving parts going on here. And so having that core trust that we built in that beginning phase of detecting cancer early is really important. We leverage that trust. We leverage that trust to make sure that we're engaging with members in a different way, right? And so what that means when you get to this point is this: how quickly can we get you from diagnosis to treatment, right? This is where we're leveraging work with OpenAI and our Copilot program to actually leverage information and close gaps from diagnostics so that when you walk into that oncologist or that surgical meeting for the first time as a cancer patient, it's an actionable meeting. 40+% of meetings that happen the first time when you go in are not actionable because these diagnostics are not done. That means more cost to you because you're gonna have to go back in again, right? But it's a horrible patient experience, right? I thought I was going in to get treated for cancer, now I have to go wait 2 more months to get these things done, right? So how do you make that experience better? When they get to that point of needing a place to go, how do you make sure you get them to the right place that's gonna follow guidelines, right? That's gonna take advantage of the pharmacogenomic information that you're gonna give to them, right? That you're gonna use genetic information to make sure that the drugs they're using are gonna not cause harm, but be helpful, right? How are you guiding them to those right places? Whether that's a COE, right? An NCI COE, whether that's a local oncologist, right? Making sure what's right for that member. And then, how do you think about the other aspects of this? How are you managing symptoms, right? Making sure that people don't show up at the ER. How are you managing the financial and mental burdens that people are going through? Everyone in this room offers benefits to their employees, or they're on employee benefits, right? But when you're a cancer patient, there are costs that are just not covered, right? There are rides to treatment that you need to figure out. There's your spouse taking time off work, right, to get you to treatment. Those all cause that financial burden. How are you managing that? How are you supporting your members with that, right? It's really important to think about that. And so when you look at these things, when you look at driving people to NCI organizations or local oncologists that are gonna follow the guidelines, right, appropriately. They're gonna get to the best possible outcomes, right? When you keep people out of the ER, right, you manage their symptoms, you're that person that they can call 24/7, and you can write scripts for them for Zofran or whatever they may need at that time, right, because you have a 50-state medical group and you can manage all those things, right? And when you give people a place to call when they don't know where else to go, you create really high satisfaction, right? So that's the second lever of ROI and return, right, and savings, right? You gotta manage treatment appropriately. You gotta do the first one and the second one. The real key here though, guys, is this is an area that most people don't think about at all, and that's survivorship, okay? At any point in time, you're gonna have 5 times more survivors on your payroll than active cancer patients, right? These people are just trying to get back to work. They are just trying to live their life like they did before they were an active cancer patient, right? They are dealing with mental health issues, physical health issues, dietary issues, right? They are really struggling to just get back to the life they want to, and they don't know how to talk to you about it, right? They don't know how to tell you, I'm gonna be really tired at 2 in the afternoon. I may have to go take a break from work. Or, by the way, I have these other scans coming up, right? And I'm gonna have to leave work to do this potentially. So how are you gonna manage that? How do you manage that, right? You try and take that burden off them, right? You put a solution together that says, we're gonna manage all the screenings for you, we're gonna manage all the imaging appointments for you and make sure you don't have to take off work if you need to. We're gonna get you back to work and help you understand how to talk to your employer, or will talk to your employer on your behalf, right? We're gonna help the team around you to understand what you've just gone through, because it doesn't end, right? It doesn't end when you're a survivor. And unfortunately for these folks, right, when you think about not only what they're going through as a survivor, but also as an employer when you're trying to think of costs, right, the unfortunate part is these people are 50% more likely to have a recurrence of cancer or have another cancer, right? They need ongoing care. And you probably don't see this in your data because you don't know they're a survivor necessarily, right? And so on average, they cost 5 times more than someone who hasn't had cancer. So managing that appropriately can drive down costs over time, right? And so you need to make sure everyone gets a care plan. What are they actually doing? Unless you're going to an NCI accredited COE, and even then if you can get in, you're not getting a survivorship plan, most likely, right? So you gotta make sure everyone understands what they need to do physically, mentally, dietary-wise to survive, making sure they're following through. Mental health is a huge issue for survivors, okay? It is not as simple as picking up the phone and saying, call Lyra or Spring or whoever. I work with those guys, they're great people, but they're not focused on cancer, right? They don't have folks that have gone through that same journey that they can talk to and feel good about. Having clinically evidence-proven outcomes on mental health is important, especially in survivorship. And then again, just going back to just bottom line ROI, right? Bottom line savings. If you can create this vertical aspect, this vertical program, right, that takes a lot of this need for referrals out to specialists, managing the day-to-day care for people while still coordinating all that care, right, and managing the care for people, you can really drive costs down, right? Now, I'm not here to tell you that we need to be the quarterback on everything, by the way. We built this solution and working with partners to make sure that we understand how to leverage the ecosystem benefits you've built, because you've invested in other places. Let's take advantage of these things. Let's manage them appropriately, and in some places play the quarterback, in some places not, right? So what happens when you put something like this into actual practice? So I'm going to talk about Kristen just quickly, just a really quick example for you guys. So Kristen is she's a mother of 3. She actually lives in upstate New York. And she's 43, right? She saw, one of our flyers that we sent out saying, understand your cancer risk. She took our clinical assessment. She found out that she was late for, a mammogram. And so our care team, our clinicians, both physicians and our care coordinators got her in for a mammogram. We got that scheduled within 2 weeks of her going through this, right? Found out that we had an abnormal result, unfortunately, right? So we immediately got her in for a secondary diagnostic mammogram and found out that she actually needed a biopsy. So we got her scheduled with a surgeon to get the biopsy done, right? Throughout that process, we're continually talking to her, right? This is a very scary time. Do I really have cancer? Do I not have cancer? What's going to happen if this? What's going to happen if then? Who's going to work with my family? Who's going to take care of my kids, right? So continually working with her to be that support system, both from a clinical perspective as well as non-clinical perspective, right? And at the end of this, right, unfortunately, we found out that Kristen had breast cancer. But fortunately, we found out that it was stage 1, right? And so we're able to apply, very common practice in medicine to make sure we could get her treated at a much lower cost, increase her survivability. But the most amazing part of this whole example is this. We did all of this in 52 days, okay, from start to finish. On average, this takes 155 days in this current system, right? So we reduced that time by over 60%, and that reduced time is the difference from one stage shift to another, right? And so when you shift cancer from one stage to another, costs increase, survivability decreases, and outcomes are just not as good, right? So we're very proud of this kind of work that we're doing. We're doing this across our book of business. When we talk to employers and they're trying to figure out what to do and think about how am I going to get an ROI? How am I going to, I'm going to make an investment. Where am I going to make an investment? Cancer is my number one spend, but I don't know what to do. Stories like this resonate because everyone's had people in their life, right, that go through this. So I know I'm between you and networking and lunch and all these things. So I will close on this. If you are interested in trying the program for yourself, or you want someone else to try it, you can scan this code. It's a trial available. You can do the genetics workup, et cetera, as well. We also have these available down at the booth downstairs. But I invite you to try it. I invite you to experience for yourself because there's no better way to understand the investment you're going to make without trying it yourself. And with that, I will be done.